place was actually recommended by Nick's occupational therapist. My son has extremely low muscle tone, and when we started coming here about 6 months ago, he could sit, but in a very awkward position. He was really unsupported. He didn't stand, he didn't walk, we didn't do any cruising. We were crawling, but that was really about it. And when we started coming out here, he has, within about a month, he was pulling himself up to a standing position and holding on to things and cruising around the furniture. And about 3 months ago, he decided to let go and start walking. And my life has gone downhill ever since. So he's just made unbelievable progress. He has so much more energy. He has so much more willingness to try and do things. He has, it's just been an amazing amount of progress he's made in just the past 6 months. He loves the horses. We pull in, and as soon as he sees us pull onto the driveway, he's in the back seat, and he only has a couple of words that he says, but one of the words he knows really well is horsey. And he gets real excited when we're showing up to see the horses. And he has no fear of them. He'll walk right up to them, right under their feet if you let him. But he just absolutely loves being on them. It's the only therapy that he does, and my son does therapy about 4 days a week. It's the only therapy he does that he doesn't try to not do. He doesn't try to get out of. He doesn't try to get off the horse. He just loves to do it. So it's been unbelievably successful for him. Both his pediatrician and then all the specialists he sees are all really pleased with his progress. They actually are very, very amazed that he's gone from not crawling or not walking, not anything, and then 6 months later he's running around and doing everything he's doing. Because with his diagnosis, that's not generally the case. So they're thrilled. Well, it was highly recommended to me by his occupational therapist, and I trust her judgment very well. So I didn't have a high level of fear. I actually thought the horses would be much smaller, truthfully. I thought we were talking ponies. The therapist really, they showed me what they were going to do, talked to me about it before they did it. Once they explained it to me and they showed me what they were going to do, my fear level was really not there. I mean, I really never had a whole lot of apprehension about it. And he loves it, so if he's willing to do it, he can do it. So no, I mean, from the day we came out here for our very first meeting with Christy, she's never promised me that this is a miracle. She's never said, "We're going to put your son on a horse, and in 3 weeks he's going to start walking." What she's told me is that, she explained how being on the horse strengthens the muscles. She's explained what the benefits are, and truthfully, any benefit that I thought in my head we would get, we have tripled anything that I thought we'd get. So they're very upfront and very realistic with what the potential results are, and I think generally the therapy far exceeds anything they tell you. My son has a very limited speech ability, but being around things that excite him really get him to talk, and he's picked up. He's using in everyday language a lot more words that he wouldn't have used normally. Go, stop, on, off, up. Anything to do with getting on a horse, riding a horse, or being around them, he's learned the words. And he really, he's just a lot more vocal. Even when it's words you don't really understand that I'm sure make sense to him, he's just using the vocal cords, using speech in any form. Being on the horse really gets him to do that just because it's so exciting for him. So it's definitely paying off in more than just the physical therapy aspect. I just think that this everything that the Smith Center does is so it's so different from what you get from a normal physical therapy, occupational therapy kind of treatment setting. The benefits to the kids that I've seen out here, not just my own son, but the other kids that are here when he's having therapy, the interaction with the animals, the being outside, doing something that's fun that also provides just a really wonderful benefit for them. It's an amazing program, and anything that somebody could do to help make it a little more financially possible.
Nicholas is a 2-year-old boy who's been riding since July, so here it is December, so it's been about 5 months. And he presented with extremely low muscle tone, very floppy, barely able to sit up, definitely not able to stand by himself, was barely pulling up on furniture, and he just really wasn't making any progress in conventional therapy. He was referred here by his occupational therapist, like I said, about 5 months ago. And since then, I think it was after 2 treatments, we saw definite evidence of progress. And after 4 treatments, or after a month, He was standing up by himself, he was taking a few steps, and then 2 months after he started riding, he was walking independently. Completely unbelievable. Hippotherapy gave him the muscle tone, the trunk strengthening, gave him the confidence to be able to move on with his mobility skills. Nicholas has Prader-Willi syndrome, which it's a genetic syndrome. He was born with it. And typically it's characterized when they're little, like Nick, characterized by very low muscle tone, delayed speech, delayed mobility. And then as they grow into adolescence, it's characterized by overeating. And they tend to eat things that aren't even food. They eat, typically non-edible things, to end up locking up the cabinets and the refrigerator. But when they're little, that's not their issue. Their biggest issue is their developmental delay and the floppiness that they present with. When Nicholas first gets on the horse, he's extremely wobbly from the head all the way down. His head is really bobbling on top of his body in all directions like a bobblehead. And then his trunk has difficulty staying in the middle like a weeble wobble. He'll move front, back, side, and kind of go around in a circle. Sometimes he'll really lose his balance and completely go all the way back. He'll lose his balance side to side, and then his hips also, usually about the first 10 minutes of treatment, his hips will slide off laterally to one side and then to the other. He just doesn't have the ability from the start to stabilize himself in any way, whether it be his head, his trunk, or his hips, on that extremely dynamic surface. Usually within 10 minutes, he's able to start pulling himself together from the movement of the horse. He's able to sit up straighter. He's able to reposition himself to the middle. He's got better body awareness. There's less of a C curve down where his spine meets his pelvis, more of a 90-degree angle, which is more upright sitting. There's less curvature through the thoracic spine. He's just a lot more straight, and his head, he's pulled his head together too. He'll be able to focus on an object, focus on whatever he's playing with or reaching for, where he's not able to do that. We have to use the first 10 minutes definitely for a warm-up because he's all over the place at first. Generally, well, when I first started seeing Nick, he wasn't saying any words at all. He was so floppy. He had zero breath support. His diaphragm had no support to push out any sounds. His rib cage was extremely flared, which makes it very difficult to elicit any sounds or any noise, let alone any words. Through hippotherapy, he's now able to sit up straighter. His rib cage has elongated. The muscles have become activated. His diaphragm is a lot stronger. He's able to push out some sounds. He definitely has many, many words in his vocabulary now, especially no and all done and mommy. But he can parrot words. We call that echolalia. Anything that you present to him, he can say it in return. It's just a little bit slurred. His intonation has improved, and also his volume has gotten better through hippotherapy. To go, like I was saying when we were out in the field, even in 30 minutes I can't accomplish everything that I need to get done with him because he fatigues so fast, and granted he was sick today too. So as he continues to get stronger, we'll definitely continue to see more gains. I'm hoping that by March, he appears drunk when he's walking. As you can see, he staggers all over the place. I'm hoping that's decreased by at least 50%, that he's a lot more stable. He has a real hard time standing still. I'm hoping that his balance statically will improve. And also I'm hoping that he's going to be able to start initiating some kind of jump in place, jumping off the ground and down. He doesn't have that ability at all right now. So by March, the end of March, that's what I'm hoping for.